My next guest, college-educated daughter, two friends of mine. She also admits to being a former prescription drug addict. She's come up, though, she's clean. She's come up with a great idea to keep users from doctor shopping. Her name, Molly McGee. Her charity is called RX Verify. And the idea, I guess, Molly, welcome to the program, to set up a national database so people can't go from one drugstore to another, to one doctor to another. How does it work?
Correct. What we have in this day and age is this national epidemic.
Right.
100 people a day are dying from this prescription drug overdoses. RX Verify charitable work is going to be able to allow Americans, our fellow Americans who are not as fortunate as myself, provide them with scholarships to be able to be admitted to high-end treatment centers.
Great. But how about the database? How does that work?
The doctor shopping is feeding this addiction. RX Verify is here to starve it. This particular organization, when somebody goes into a pharmacy with a prescription for a class 2, 3, and 4 drug, they will be able to look up and see if this, whether it be an addict or someone who is currently becoming addicted to the drug, it's been filled too soon, or if they're abusing it.
If too soon, too often.
Correct.
Didn't you you just had an OxyContin case?
She's right on. I mean, I'm representing a young man right now who had a bad back. It usually starts off innocently, Geraldo, with a real injury, and the hospitals, the doc, they can't wait to give you this pill because it does ease your pain. So what happens, the kid gets addicted on it in Brooklyn, and his Brooklyn doctor does the right thing and limits him. So then he goes to Staten Island and says, oh, and that doctor doesn't know that the doctor in Brooklyn already gave him a prescription. Then that doctor cuts him off. Then he goes to a doctor in Manhattan. 3 different boroughs. One doctor, one hand doesn't know what the others do. So what she's saying is exactly what we need. A uniform database that says, wait a minute. Arthur already went and got 60 pills in Brooklyn. You can't now get 60 pills in Staten Island and 60 pills in the Bronx.
How are you doing, Molly?
Today, I'm doing fabulous. You know, I just came up on 2 years of my sobriety. Okay. In my active addiction, you know, this tears apart families, friends. I was deteriorating. You know, everybody around me saw me deteriorating. I needed to make the change. You know, when somebody's hungry, they're going to go out and feed their hunger. An addict, when they want to go feed their addiction, they're going to go do it. And this is what's going on. And the doctor shopping is what's happening. And RX Verify is here to starve it. We know it's not working, or else I wouldn't be here today. These state agencies and federal government, their approach has not been effective. So my approach is going to the dispensers level.
To the drugstores?
Correct.
The drugstore looks it up. Hey, buddy, this has already been filled.
Correct.
You know, I know it's a charity. And you have somebody bankrolling the charity? You're not asking for donations. Right
now, we're not accepting public donations. We're working with a single philanthropist who is passionate, just like myself. I'm here to save lives. Okay?
Well, good for you, Molly.
I want to save lives, you know. I was on my deathbed, and I'm here to spread the message. This awareness, this epidemic needs to stop, and RX Verify is the way to stop it.
Welcome back.
Thank you so much.
I'd love to have